Hi, I'm Dr. Bill Carlazon, Principal Editor of NPP Digital Psychiatry and Neuroscience. Welcome to the DPN Deep Dive, our journal's AI-generated podcast that summarizes DPN articles in short, accessible episodes. Each episode is approved by the authors and designed to make listening easy and fun. Let's dive into this episode to explore the latest research in digital psychiatry and neuroscience.
Imagine you are actively struggling with your mental health. You finally take that difficult step to reach out for help. And then you are told the wait to speak to a doctor is, 8 to 16 months.
Yeah, it is a really stark reality for a lot of people. Right now, across the United States and Canada, roughly 60 million people need mental health support.
60 million.
Exactly. And yet, 2/3 of those people cannot access it. The demand has just completely outpaced traditional one-on-one care.
Right. And then the current triage system we use relies heavily on these subjective checklists, right?
Yes, usually filled out on a single, highly stressful day, which really does not always capture the full picture of a patient's recurring distress.
And that bottleneck is the focus of our deep dive today. We are exploring a highly scalable, algorithmic solution to this triage problem. Our source material is a recent journal article titled, Using Large Language Models as a Scalable Mental Status Evaluation Technique.
Right. And just to note, this research was conducted by teams at the University of California, San Diego, and Queen's University in Canada.
Okay, let's unpack this. I guess we should start with the experiment itself.
Sure. So the researchers set out to determine if we can automate the detection of anxiety or depression using only written text. So they utilized a RoBERTa large language model for the experiment.
And rather than just scanning for obvious keywords like sad or anxious.
Exactly. RoBERTa is uniquely suited for this because of its robust pre-training on complex sentence structures. It maps the intricate contextual relationships between words.
Right, so they trained it by feeding it individual sentences scraped from online mental health forums?
Yeah, alongside actual transcripts from online psychotherapy sessions.
Which makes me wonder if my excessive use of exclamation points and fragmented sentences in morning emails is flagging me as highly anxious without my knowledge.
Well, it might.
But structurally, it is fascinating that they isolated the data down to single sentences. They stripped away all the usual clinical markers.
Right. No tone of voice, no physical tics, just the raw text of a statement to see if the model could correctly classify it as symptomatic. They forced the model to rely entirely on natural language processing to extract meaning from the raw data.
So how did it do?
When tested against real clinical data, the model correctly identified symptomatic sentences with roughly a 74% accuracy rate.
74%. Out of context, that sounds like a C grade.
What's fascinating here is how that number compares to the human baseline.
Oh, right. The researchers had clinical experts evaluate those exact same isolated sentences.
Yes, and the professionals only agreed with each other 76% of the time.
Wow. So the model is essentially grading just as well as a panel of human experts.
Exactly. The fact that a mathematical model can match that level of human consensus using nothing but text is a massive leap forward for standardizing how we measure mental status.
That is impressive, but 26% of the time, the model is still getting it wrong. I assume that is a direct result of reading text in a complete vacuum.
Yes, that is the primary limitation here. We are talking about isolated sentences, so it is entirely missing the broader context of the patient's ongoing conversation.
It is very much a proof of concept for analyzing isolated text, not a comprehensive diagnostic tool.
Right, it lacks access to the contextual timeline of a full session. And it cannot register a sudden shift in posture, a vocal tremor, or a lack of eye contact.
So what does this all mean? Why does algorithmic triage matter to you?
Well, imagine a near future where objective technology instantly evaluates patients the moment they reach out.
Instead of everyone sitting on the same 16-month waiting list.
Exactly. The system could ensure that the severely limited number of specialists are routed immediately to the individuals in acute crisis.
It is a logistical bridge. We cannot instantly manufacture thousands of new doctors to meet the 60 million people in need.
But we can optimize our initial evaluation process to ensure the right resources get to the most urgent cases immediately.
It redefines how we manage the supply and demand of healthcare. But before we wrap up, consider this. If a computer model can accurately detect anxiety or depression just from the structural phrasing and word choice of a single typed sentence,
Right.
What might your everyday text messages or work emails be revealing about your mental state without you even realizing it?
That is a wild thought.
Thanks for listening to the DPN Deep Dive. Until next time.